Hello, good evening, and welcome to day 7 of my Birthwell birth tips. So, if you haven't joined me already, I am doing 20 days of my best pieces of advice or tips from my workshops to help you have your positive birth. So, I put a little question box up during the week there to ask, what did you want to know about birth? Because I have all these ideas of, hey Laura, how you doing? I have all these ideas of what I should be telling you and the tips that I think you need to know, but I want to know what you want to know as well. So I do have another question box in my stories. If you want me to talk about something, feel free to jump into it and let me know. But this was a question that came in from a follower who wanted me to talk about the public versus private and what is the best way to go, essentially. And I'm never going to tell somebody you should do this and you should do that. Everybody makes up their own mind, but I thought I'd go through the options with you today and let you know what the evidence says, essentially. And I have notes here because there's a lot to cover and I don't want to forget something. So for those of you who don't know, maybe you're not pregnant yet, maybe you're trying to get pregnant, or maybe you're just at the start of your pregnancy journey, you essentially have 4 options when it comes to having your baby in this country, in Ireland. So I'm talking about Ireland here. So if you go public, you can either give birth in the hospital, or there's also an option to have a home birth through the public system. And that's actually something some people don't know. So if you go through the hospital, you're essentially getting midwife-led care. You will nominally be under an obstetrician, under a doctor, but if there's no issues with your pregnancy, if you're doing fine, you will pretty much see the midwife when you go into the hospital for your clinic appointments, and you'll generally speaking only see a doctor if there's something wrong. Okay, and as I said, you can have a home birth as well through the public system. So we have self-employed community midwives in this country that are paid by the HSE. So you can sign up with one of them and have a home birth through the public system, and then you would have your continuity of care with that midwife through your pregnancy, and then they'd be there at the birth as well. So that's your public options. And as I say, in both those incidences, you may be technically under a doctor, but most times you're possibly not even going to see them, or at least not see the senior doctor, unless there's a problem, unless there's an issue. And from a clinic point of view, then you would see your midwife or you would see your GP. And then when it comes to the birth, it would be the midwife that would, a midwife, if you're in the public hospital, you won't have the same midwife that you might have seen in the clinic. If you're home birth, you will, but you will see it'll be a midwife that takes you through the entire birth process. From a private point of view, then you have 2 options as well. If you want to have a home birth, so if, for example, you couldn't find a public community midwife around your dates, or you weren't eligible, HSE has quite strict guidelines on home birth. There is an option to have a private home birth with a company called Private Midwives Ireland, and they offer a fantastic service, and their eligibility criteria is a little bit easier. Is that the best word to describe it? But sometimes if you're ruled out by HSE, you can still have a home birth with private midwives. So you do have that option. And that again is midwifery-led care. You have your midwife you see during your pregnancy and who's there at your birth as well. And then the other private option that most people would be familiar with is where you hire a private obstetrician. And what would happen there from a clinic point of view is you'd either see your own GP or you'd see your obstetrician, your OB. And then from a birth point of view, you would be giving birth in hospital. And for most of your birth, it will be with a midwife that is in the hospital. Generally speaking, all going well, the obstetrician really only comes in near the end of your birth, for the last, could be 20 minutes, half an hour, whatever, and catches the baby as such. Unless, again, something goes wrong and they might be called in a bit sooner. And on that as well, that assumes your obstetrician is there. So if it's a weekend or late at night or whatever, you're not going to get the private obstetrician if they're not around, if they're not on call. You're going to get whatever obstetrician happens to be in the hospital. So sorry, I'm checking my notes so I don't forget any of these things. So yeah, that's your options. So I suppose the question that I really got asked was, what's the best option? And I mean, I can't make a decision for everybody, but what I can tell you is what the evidence says. And the evidence says that you have less interventions and better outcomes under midwifery-led care. So be that home birth or in the hospital, the outcomes are better for women when it is midwives. And I don't have anything against obstetricians personally. I went privately myself, and I'll explain those reasons in a minute. But this is what the evidence is saying. And it's because, I think anyway, a lot of it is to do with the fact that obstetricians, generally speaking, are only called in when there's problems for a birth, for example. So they see a lot of problems and they see a lot of non-physiological birth, whereas midwives see normal physiological birth a lot. Not as much as we'd like, but they see a lot of it. So they're used to that, whereas obstetricians are seeing problems all the time. And they have all these skills and they really want to help women. So they're a little bit more inclined to maybe use interventions and go straight to the interventions than a midwife would be. And that's, as I say, that's what the evidence is saying. So again, it's entirely up to you. Some people like the comfort of having an obstetrician, especially if they've had issues. So maybe if they've had assisted fertility, if they've had a lot of gynecological issues anyway, and sometimes that can help. For me, I wanted a home birth, but I was ruled out because I had prior to my kids, I'd had a myomectomy, which is a fibroid removal, which is essentially the same operation as a cesarean. So at the time, there was no private midwives, there was only HSE, and I was ruled out from HSE home birth. My gynecologist then said to me, well, your next best option is to go private. And he specifically gave me the name of an obstetrician who he knew would support me, even though I was technically had risk factors, if you like, because I had that previous operation. So for some women, that's what they want, and that's totally fine. Just make sure that you get the right obstetrician for you. Shop around, ask people, find out, make sure you get somebody who, like I did, who was willing to, look at me as an individual person and not apply just policies to me. And listen to my previous gynecologist who said, yeah, the risks were low actually in reality rather than what it might have looked like on paper, and who was willing to, let me say no to a lot of things, because that's essentially what I did. But yeah, that's because I got a really good recommendation from someone I really trusted, and that's what's really important. So if you're thinking about going privately, for whatever that reason that is, just make sure that you find somebody that's really good, and not somebody that just seems nice on the day, because I've seen that with clients where when they go in initially with an obstetrician, they're great, and then when you get near to the birth, then the pressure starts coming on, and then let's induce you at 38 weeks and 39 weeks, and they can be a very different person then. So make sure you get a good recommendation for somebody, and really get educated on your choices. So really know what you want, why you want it, and be able to go in and defend your birth plan with your obstetrician, and that's what you should be doing anyway. We should all be discussing our birth plans up front, so we know where the sticking points might be, and hopefully your obstetrician will be on board and it'll all be good. If it's not, and this doesn't happen very often, but if it's not, if you find, well, actually I shouldn't say very often because I see it quite a bit, if you find that your obstetrician really is trying to force you down a route, for example, of induction that you don't feel you need, or just totally isn't on board with your birth plan, you don't have to go ahead with them at the end of the day. Even as late as 38, 39 weeks, 40 weeks, I've had clients do this. Hey, how you doing? You can leave. I know you might have paid quite a bit of money, and you might still have to pay that money to them, but you can go back to the public system at the end of the day and go for the midwifery-led care. If you're really, really not happy, because you want to be happy going into your birth. You want to trust this doctor that's going to, help deliver your baby, catch your baby. So yeah, you don't have to stick with them if you really are uncomfortable. But again, that doesn't happen all that often. So that's your choices. And as I say, the evidence would say that you have less risk of interventions, better outcomes if you go through midwifery-led care, whether that's hospital or home birth. And just to say that on home birth as well can sound very scary to people, but again, tons of evidence out there that home birth is as safe, if not safer, than giving birth in a hospital, pretty much for those reasons again, because there's less interventions and there's less chance of interventions if you're in a home birth setting. So that's it. That's my little summary. Hopefully that was useful to you. And yeah, join me tomorrow for day 8.